Hello, I'm Derek McStay, and welcome to the answer to the health and safety question that you've posted. The question that's been posted is, how do I carry out a COSHH assessment? So COSHH stands for the Control of Substances Hazardous to Health, and it's a UK regulation. One of the requirements of the regulations is that you have to do an assessment of any harmful products you're going to use. So there are 5 key steps in carrying out a COSHH assessment. Firstly, we identify the hazards. Secondly, we evaluate the risks. Thirdly, we look to eliminate those risks or control them in a way to prevent harm. Fourthly, we need to communicate the results of our assessment to those that are using a hazardous substance. And fifthly, we need to monitor and evaluate the results to make sure that any control measures that we've put in place are working correctly. So let's look at some very brief examples of those 5 key areas. So identifying the hazard. So we're looking at what from the chemical could cause us harm. Is it something we're going to breathe in? Is it something that we're going to get onto the skin? Is it something that we could swallow? We then have to evaluate the risks. So if it gets onto our skin, if it's let's say a water-based product, it might not cause us so much harm. If it's a chemical-based product, it could dry out our skin. Again, if it's something we could breathe in, is it a harmful chemical fume that could irritate the lining of the lungs, causing us to cough, or even worse still, breathe in a very dangerous fume which could cause us to become unconscious? Another example might be, could we ingest a liquid? Could it be something that we swallow, gets into our mouth and then into our gut? And again, that could cause us some problems. So that's evaluating the risks. What the COSHH regulations then require is for us to eliminate those risks wherever possible. And if it's not possible to eliminate them, then to control them in some way. So the elimination is easy. We get rid of the substance, we don't use it, or we use a safer product. Or we can control the risks by maybe local exhaust ventilation to pull away any fumes, or we could wear personal protective equipment such as gloves to stop it getting onto our hands and onto our skin. It is important to remember, though, a control measure using personal protective equipment is the least favorable control measure, and we should be thinking of other controls before we adopt personal protective equipment. We need to communicate the results of that COSHH assessment to our employees, so we need to provide them information. That could be in the form of giving them a COSHH assessment, giving them a toolbox talk, giving them a briefing, or providing some training. And then our last step was to monitor and evaluate that our control measures are working. So we might want to do some spot checks. We may want to review on an annual basis the COSHH assessment to see if there's been any changes to the process, or is there a less harmful product on the market that we can actually use. So they are the 5 key steps to undertaking a COSHH assessment. I hope you found this answer useful. Please come back and have a look at the RNA website, where there are lots more answers to questions you've posted. Thank you for listening.